Hello, I'm Megan Lucey. I'm a third-year nursing student at the Penn State Scranton campus, and this is the role of the nurse in the treatment of persons impacted by cellulitis. So this study was a literature review about cellulitis, the best practices for caring for patients with it, and barriers to caring for patients with it. So the research starts off with a background of cellulitis. It's a bacterial skin infection of the deep dermis and subcutaneous tissues. The areas affected with it typically present with redness, pain, and swelling. And there's a picture on the left-hand corner showing cellulitis affecting the lower extremities. The infection can occur anywhere, but it's most commonly on the legs and feet. Diagnosis is most often made through a visual inspection, and there's about 700,000 cases annually. So this is a significant illness. 30% of patients with cellulitis get misdiagnosed, which is a pretty significant amount. Usually the misdiagnoses are eczema or lymphedema. The methods for this study was a literature review about the best practices and barriers to care. And the results were best practices such as a complete medical history, questions about recent trauma or injuries, because cellulitis is most commonly acquired through a cut or an injury where the bacteria gets into the skin, a thorough physical assessment, pain management, antibiotic administration because it is a bacterial infection, proper wound care, preventative measures, including compression therapy to prevent this from recurring, and patient education on how to prevent these types of injuries. Barriers to care were accurate diagnosis, because again, cellulitis is very misdiagnosed. Knowledge deficits, patient participation in the treatment plan, so working on preventing these types of issues from occurring, lack of patient-centered interventions. And the conclusion is that nurses should be aware of the signs, symptoms, and causative agents of cellulitis. Thorough physical assessments and medical review of history are needed for an accurate diagnosis so it doesn't get misdiagnosed. And nurses can use the best practices shown below to provide quality care for patients impacted with cellulitis. And the last thing is just a little recipe for success for caring for patients with cellulitis. So the first thing is a thorough assessment, making sure you're getting all the details, all the history, what happened to cause all the swelling and redness, proper pain management, antibiotics, getting rid of that infection, and wound care, and prevention education so that it doesn't happen again. And those are the best practices for treating a person affected by cellulitis. Thank you.